So welcome to this trio on Menopause Conversations today. I'm delighted to have my guest, one of which who's been on before, Dr. Samantha Brown. So welcome back. And she's brought her lovely colleague with her, Dr. Fiona McCarthy from the Bronte Clinic. I'm a really big fan of the Bronte Clinic. Just really lovely. I think you scream and shout that nurturing, caring approach for women and all your clients. So but we've got a topic that we're going to really get into very, very quickly, which is about skin, particularly during midlife and specifically during the menopause. So over to you, ladies, in terms of what's going on with our skin in midlife. Tell me. I've got my lipstick here. I don't know why that is. Probably because my lips feel dry, actually. So tell us what's going on with skin during midlife and why we should be paying attention to it.
So usually during midlife, obviously with the menopause, your estrogen is reduced. Now, the first thing that you notice, or most women notice when coming to my clinic, and I do the aesthetics part of the clinic, is that they will say, gosh, my face seems to have dropped, or I just feel like I'm aging really quickly. And in the first 5 years of menopause, you lose about 30% of a protein called collagen. And collagen is the kind of support and structure to your skin. So what you will find is that all of a sudden you'll notice more jowling, or your skin loses laxity because you lose your elastin as well. So that structural support that your skin has had all towards your 20s and 30s, because of the depletion in estrogen, your collagen depletes in the first 5 years. So that's a huge motivator for women often coming to clinic to see whether what skincare they need, what treatments they need because of that collagen depletion. But as well as the collagen depletion, you get lots of other problems with the menopause as well, because you have estrogen receptors all over your skin. And the estrogen reduction has an effect on both the sebum production and your hyaluronic acid production. And hyaluronic acid gives the kind of the juiciness and the plumpness to our skin that we are used to in our kind of 20s. But hyaluronic acid also maintains the skin barrier. And if the skin barrier isn't maintained and working properly, we start developing problems like dryness and itching, which are very common symptoms in the menopause. Your pH changes as well of your skin during the menopause. And again, your skin as a result can become more sensitive to things that you may have used for years and years, and all of a sudden they're really bothering you. And one of the other things that I see quite a lot with the menopause is because of the estrogen reduction and the imbalance with the hormones, your androgen hormones, so like testosterone, can increase with the reduction in estrogen, and women start developing spots. And it feels really unfair going through the menopause and having all of those issues and then getting spots as well. You kind of think, well, surely if I am going through this, I should at least have good skin or no spots. And then that happens as well. So it's a real kind of mix of everything. And it can really affect your self-confidence, I think, more than anything.
Yeah, that's so true. That was me all over. I had acne from my teenage years, all over my back. I mean, I desperately wanted to wear a backless wedding dress, and I went on all sorts of things to sort that out, and it did. Yeah. And then 2 years after having my daughter, I was like, what the hell are all those spots on my neck and around my chin? And now I know exactly that. So coming to Dr. Sam, in terms of that whole perimenopausal shift then, how do we know what's going on in terms of, through that perimenopause? I mean, where might we see the changes in our skins initially, would you say? Where might you see it initially?
Yeah, and I think it might be one of the first symptoms that you notice that you have not had. Like you, Samantha, I started to get spots again, and I was very spotty as a teenager, nothing. Big spots. The other thing that I had, and a lot of patients mentioned to me, and probably you as well, Fiona, is itch. Like really nothing on the skin, nothing to see, but just really itchy calves, to the point where I had scratch marks on my skin. So acne, itching, I think hair loss is another common one that's mentioned to me, or hair thinning and just getting clumps coming out. And the dryness as well of skin, dry eyes, dry mouth, pigmentation as well. I know you want to talk about that, and I definitely spot big. I'm freckly anyway, but big spots, and patients notice pigmentation as well, and that sensation that something's crawling on your skin, which is really horrible.
Yeah, that's that formication, isn't it? They
Yeah.
describe that. My mum definitely had that. I didn't have that so much. So we've got so much we want to talk about. So can we start then with that hyperpigmentation? And if I come as close to the camera, maybe people can see it. But I've got it really here. It's just, honestly, it doesn't matter how, and here, it doesn't matter how much foundation and stuff I put up. It's just like it's like a congregation of pigment that almost is like that dark stuff that you get here, but it's sort of here, and it's just like I can't cover it up. So can you tell people what hyperpigmentation is and why it pops up again in this midlife point?
So there's lots of so hyperpigmentation is anything that that's the increase in pigment of your skin. So anything that can cause that. It can be caused by things like melasma being a hormonally driven pigmentation process. And that pigmentation is often very symmetrical. You'll often get it here, or you'll get it around here. And that is a chronic condition, but we can do a lot to improve it in the short term and then control it long term, but you'll never get rid of it completely. The hyperpigmentation that often women get when they get a bit older, and men as well, more sun damage related. We all grew up in the kind of 70s and 80s that, God, speaking for myself, I used to wear factor 15, if that, to be honest, I used a lot less, and would baste ourselves. So we are now seeing, when you're hitting that age where your cell turnover is reduced, you're seeing the impact of the sun damage on your skin. So you're getting the age spots and the pigmentation, particularly around.
Oh, she's frozen. Oh, no, you're back. You're back.
People often will say that they can't cover it up with foundation, and that they're constantly trying to put concealer over it. So it's those kind of things. And that's a really common skin complaint during the menopause as well. And actually anywhere from your mid-30s onwards, when your cell turnover starts to reduce. But there's lots of things you can do at home to improve hyperpigmentation, and a lot of topical treatments rather than doing any more invasive treatments in clinic to treat it.
So can you give us some? Because I said to you, I started using vitamin C serum, and I thought, I'll give that a go. It was on a long list of things to do, plus sunscreen. So maybe Dr. Sam, in a minute, you could tell us about the importance of sunscreen as well. But I did notice that, and actually, it did really improve. It hasn't gone. And I've just sort of grown to be a bit more comfortable with it, which I think is the mantra throughout the whole menopause, isn't it? We are changing. You try and fight the change, or you can embrace the change. And so, how we get comfortable with that. So what would you say would be the top things that people could try that are probably more affordable for all of us? What could they try?
So first of all, I always say to people, like, aging is a real privilege. Like, we are so lucky. There's lots of people to get to this age, and we are very lucky to be it. But we just want to do it at our own rate. And I think that's the people often feel very conflicted about doing any kind of treatments or anything like that, or using creams and stuff, but actually it's just trying to feel the best about yourself that you can. The things that work: SPF every day, and that's 365 days a year. So there's now evidence that SPF is anti-aging as well as protective. So I would say a factor 30 to 50 every day. The good ones that you can get, and again, they don't cost the earth. To be honest, anything between 30 and 50 will be fine. A lot of the problem with SPF is the consistency. People don't like the heaviness or anything. The one that I recommend to most people, and you can get it on Amazon, is one called HelioCare oil-free gel. And it's lovely under makeup, lovely on its own, doesn't have that stickiness, and is SPF 50. So,
and not in the moisturizer as well, Fiona, you were telling me.
Moisturizer.
Because I had a moisturizer that was SPF 50, but I don't think you get the coverage, do you?
So in terms of the actual coverage you get, so people will often say, well, I have it in my tinted moisturizer, or I have it in my makeup. That's not enough. It has to be a dedicated SPF.
And then put your moisturizer, is it?
No, SPF is always the last step.
Oh, right, okay, because that's really important, because I have heard people going, oh, well, I put the SPF, did you say first or last?
Last, always the last.
I've heard people go, oh no, well, I put that on first because that's next to my skin. So that's a really important point, isn't it?
Yeah. So always just slap it on, and ideally you should put it on a few times a day, but realistically that's not going to happen for most of us. So once you put it on at least once a day, it will protect you better than having nothing at all. So I think SPF every day. And also, even though the evidence isn't there as yet, we are on our screens, we're in front of computers all the time. UVA rays can penetrate glass, and we're sitting next to windows, we can still get them. And the UVA rays are the ones that age us. The blue light.
Oh my gosh, shall I tell you what I'm sitting under? It's like literally a window right there.
Here you go.
So I'm really not helping myself. I'm literally below a window. Oh,
yes. So the UVB rays are the ones that can burn you, and that can penetrate glass. But the UVA rays, which are the ones that age you, can penetrate glass. So 365 days a year. Right. That's the biggest one. Vitamin C. So you mentioned vitamin C. Now, vitamin C is amazing. So the good thing about skincare is the evidence behind skincare is limited. So just use the stuff that actually has some scientific basis. Vitamin C, and when I say vitamin C, ideally between a 10 and a 20% L-ascorbic acid, so a pure vitamin C.
Okay.
And using 5 or 6 drops of that in a serum every day does a few things. It stimulates your collagen, and that's what we're all depleting. It helps with hyperpigmentation, and it gives you a lovely glow. So it's all of those things, and it's also an antioxidant, so it's protective against UV damage from both sunlight and pollution, and particularly living in London, we're all prone to that.
Yeah. So that's really important, because again, like I think you just sort of mentioned there, and Sam, if you were able to sort of help with this. So obviously that whole thing about your skin becoming more sensitive. I tried retinol and vitamin C in one go. I won't be doing that again. Whereas I had tried it previously and it was fine. My skin, I came up in hives and all of these sorts of things. So what do we know about sensitivity generally? I mean, I'm become a self-expert on histamine intolerance, and I know that I've already got that all going on anyway. But what should we be mindful of through the menopause stage? Because obviously we're tinkering around with our hormones, aren't we? We're trying to get back to these sort of natural levels. Oh, and we're being our own experimenter with stuff on our face and our skin. So what should we be mindful of in this time about sensitivities generally, would you say?
Yes, I think things like acne, rosacea, pigmentation, broken blood vessels all become apparent around perimenopause. And I think one thing also to think about is lifestyle, because often we're running around managing lots of things, juggling lots of things. We might not be sleeping well because of our perimenopausal symptoms. We're up in the night with hot flushes. We may be feeling very stressed, which then can show in our skin. We might not be paying as much attention to diet, exercise, rest times as we should. And so I think definitely your skin can become more sensitive. You do need to change what we used to do, but that applies to skin, but everything, doesn't it? Everything is, it's a period of change for lots of different aspects of our lives, and focusing a little bit more on skincare, taking advice from, Fiona's brilliant at saying what to spend on and what you don't need to spend on, and really looking at what you're using SPF, which as a similar generation women, we didn't do so well in our 20s. We're paying the price a little bit now. Hopefully our daughters, sons will do things a bit differently. But I think, looking at lifestyle management of stress, sleep, reducing alcohol, unfortunately that does tend to increase for me as well. It's sensitivity, rosacea the next day, flushing. Stop smoking if you smoke as well, because that will show in your skin.
Yeah, and that's so important, isn't it? Because I think we could very easily, we're always looking for the cure in a bottle or a pill or a jar. And there is no magic fix. So probably a little bit controversially, and I haven't primed you that I was going to ask you this.
Yeah.
But obviously the market of menopause is $60 billion worth. It's a huge market, isn't it? And some products are trying to capitalize on that. I mean, I was only in a well-known department pharmacy store at the weekend, and it was burdened. It was, this shelf was bulging with menopause related products.
That drives me mad.
Oh, Dr. Fiona, you're a girl after my heart. It drives me absolutely blimmin' bonkers, because I think it lures people in. You know, we desperately want things to go away. We want to find a cure. There is no magic cure to our skin, though, is there? I mean, what can we say to people, you know, rather than, you know, because these things are expensive as well, aren't they? You know, really expensive. What advice can we say to people?
And they're also, it really annoys me because it's taking advantage of a vulnerability that we all have at this time of our life. And you kind of think, well, if I just throw money at the problem, maybe I'll look better than I feel.
Yeah.
And it comes from the inside out. Yes, you have to have the HRT, you have to control your lifestyle factors that can affect your menopausal symptoms. The skincare, again, skincare isn't rocket science, but it just, the PR and marketing makes it a lot more confusing than it is. The products that I recommend to most people, or the brands I recommend to most people, you can buy in Boots. And you can buy, and they're not expensive. So I really love CeraVe.
Okay.
Which is very, very mild. It has the ingredients that mimic the skin barrier, the hydrating cleanser. So particularly in menopause, you don't want to use soap because it can dry out the skin. So a hydrating cleanser, either a cream cleanser or hydrating one that doesn't strip the skin. CeraVe and Aven, both high street products, and low cost the earth, are great for cleansing. The vitamin C is something I say do spend a bit of money on, because with that you get what you pay for.
Yeah.
But things like moisturizer, again, the ones that I recommend, and I actually use myself, even I get sent loads of samples, and then when I go and buy myself are ones from Boots called Curel, which is a Japanese skincare brand, which again has ceramides, it has hyaluronic acid, so you're hydrating the skin. So the menopausal skincare brands are very good marketing behind them, and the ingredients are there. You know, you have the ceramides that help with the skin barrier, you have the hyaluronic acid, you have the glycerine, all of the things that help with protect the skin barrier and hydrate it, but they're also present in a lot of other products that are a lot cheaper. So it really irritates me seeing the emphasis now on menopausal skin, just because skincare companies think, oh well, we can jump on this bandwagon. So CeraVe, Cetaphil, Curel, great skincare products that you can get in Boots. You mentioned retinol earlier, and actually retinol is amazing, but it has to be used properly. And certainly if you go in hell for leather with vitamin C and retinol at the same time, your face will flake off.
I can confirm it did, Dr. Fiona.
So it's just using it really carefully. So what I say to people, so retinol, basically the reason it's so good is it increases your cell turnover. So it gets rid of the dead skin cells. It improves the appearance of fine lines and wrinkles, but it's a slow burn in terms of seeing the effects. It'll take 3 to 6 months, but it also improves the appearance of pores. It's a bit of a wonder product, but most people will start it and say, oh, I can't see an effect, so we'll slap it on every day. My general rules, and I'm super, super conservative with retinol, use once a week for 2 weeks, twice a week for 4 weeks, 3 times a week for 6 to 8 weeks, and increment up slowly like that. And at about 5 or 10 minutes after putting on the retinol, probably about 10 minutes, put on your moisturizer as well, just to hydrate the skin, because it will have had most of its effect. It will have, sunken into the skin at that point. So it's a great thing to use, but just use it very cautiously.
I would totally concur with all of that. Definitely. Yeah. I didn't do it again after that.
Actually, there's a great retinol in Boots at the moment. I think it's the number 7 one. It starts at 0.3%. So it's affordable and it's a low dose, and that's how you start off.
Okay, and just throw in, because I did buy some. I mean, I went all in. I just thought I'm going to get all the things that I need. Hyaluronic acid as well. So, I mean, if we were to have those 3 things side by side, vitamin C, retinol or retinols, and your hyaluronic acid.
Yeah.
You know, if I had to pick 2 of those that would really help me, so it would be affordable, which should I go for?
Vitamin C, retinol.
There we go then.
Hyaluronic acid is a hydrator. It's great, but you can buy really, really good, like cheap hyaluronic acids. When I say cheap, I mean, they're not cheap, they're 20 quid, but they're really affordable. Vichy Mineral 89 is one I recommend to loads of my patients. And I think you can often get it on a 3 for 2 in Boots. It's amazing. It has a lovely consistency, but it's just another, you don't have to have it in your skincare regime. If you use a good moisturizer, you don't need a HA or hyaluronic acid as well, but it's great for an additional thing as well. But I think vitamin C and retinol used properly will transform your skin during menopause. and a good moisturizer.
Yeah, that's so important. So Dr. Sam then, so obviously one of the things I notice about myself is I don't drink anywhere near enough. You know, so no. Well, yeah, no, and that can be taken in so many different ways. I actually did stop drinking. I didn't drink the whole of September, actually. I did a little trial, a little pilot, and I've really noticed the benefits. My birthday tomorrow, so I did have a drink last night. But you know, drinking like tea, not teas, you know, decaffeinated teas. I mean, how important is it to stay hydrated during perimenopause, menopausal years, and why should we bother with that?
Yeah, I think it's important at all stages of life, isn't it? I don't think there's a particular increased need to be well hydrated at perimenopause, but it might be a time where we're less good at taking care of ourselves because we're running around and we get water bottles for the kids but not for ourselves. But it does help with focus, concentration, so that kind of fogginess that you might be struggling with if you've not drank enough water, if you've not had enough sleep, then obviously that will that can affect those kind of symptoms. Also bladder irritation as well, so that's very common around this age, that you're getting up at night to go to the toilet. You might have frequency, urgency, and if you're not drinking enough, then often that makes it worse. Women often cut back on their fluids so that they don't have to get up in the night, but that's it. Seems to have the opposite effect. So making sure
I did notice, actually, when I went on HRT, that was the thing. I used to wake up 1:58 every single night. 1:58. I mean, I didn't even know what was apart from the fact my daughter was born at 1:59 on the 15th of December. I couldn't understand it, and I did fluid restriction. I did so many things, but it was only when I went on HRT that really helped. So Dr. Fiona, does it make a big difference about how much I mean, where does our skin benefit most, from what we put on the outside that goes in, or what from the inside that comes out? What do you think?
I think if it's menopausal, I think the best thing you can do is HRT, because it does have an effect on your skin. It takes a bit longer, but it does have an effect on your skin. But I think it has to be in combination, and it is, you're right, there's no one magic fix in a bottle or anything, but the combination of both together will make a massive difference. But it's not a quick fix. It'll take about 3 to 6 months to see an improvement in your skin, but you will see it.
Yeah, definitely.
I think one thing that Fiona and I are often asked about from the patients that we see and outside is supplements. And at the Bronte Clinic, we look at the evidence. You know, we're doctors, we're scientific, and I think that there's so many things that you could take, both for menopause but also for skin. It's a complete minefield for women, isn't it, at this time of life?
Okay, and also again, it's a thing of preying on your vulnerability. You're kind of, or maybe if I just take collagen supplements, we all hear about collagen being depleted, maybe I should just take collagen supplements, and then they're really expensive, and people are kind of again hoping for a quick fix, or I don't recommend them myself. I think the evidence isn't there. Potentially, maybe over the next few years, there will be increasing evidence, but I think in terms of the direct effect on your skin, I don't see the evidence, or I don't see both anecdotally or scientifically, the evidence for collagen supplementation.
So don't waste your time, basically. It's a bit like it's sometimes a bit like probiotics, isn't it? You know, there's a different offering around probiotics. Some that say they do reach your stomach acid or get beyond your stomach acid. I mean, it's just so difficult to know, isn't it? For the average consumer, it's like the advertising is so compelling, isn't it?
Yes.
But listening to skin specialists like yourself, it's like, don't waste your money. There's some very good products, and the CeraVe, actually, I use their hand cream, which is absolutely gorgeous. I love it. Just coming back, the Curel, how do you spell it, just so that I can put it in the show?
C-U-R-E-L.
Sorry, what was that bit?
C-U-R-E-L.
Yeah.
And the one that I love is the intensive moisturizing cream.
Okay, well, I'll put those in the show notes, but we're running out of time because Dr. Fiona's actually got busy clinic, and so we can't keep her from that. But so take home messages, the things that I've heard today is SPF 365 days a year. Do not scrimp on that. And the order in which you put it on is really, really important. Be careful about, sunscreens in like foundations and various things like that, because you won't necessarily be getting the protection. Vitamin C, 10 to 20% L-ascorbic acid, definitely go for that, because that stimulates your collagen. but to really research it, and maybe to follow you actually on your site, on your Instagram page, because Dr. Samantha, Dr. Fiona give great advice. What sort of people do you see at your clinic just before you go then? Who are your ideal clients, the sort of people that are coming and filling up your appointment schedule? Who are they?
We see lovely people.
You do, I bet you do.
See lovely women. We're very lucky.
We are really lucky. We have lovely, and also we don't have, you know, obviously we have the skincare and the aesthetic clinic as well as the menopause, and we don't have 22-year-olds looking for big lips. That's not our patient cohort. We have women like ourselves who are kind of saying, God, you know, the last few years we've had COVID, then you're hitting menopause. The combination is just, you're seeing it on your face and you don't look how you feel inside. And people just want a bit of, you know, a bit of sensible advice without having to, you know, we're very good at saying what not to do, and we're very good at saying no. And also it's just getting the right advice. And sometimes people will come in and just sit there and go, I don't know what I want, but I just needed to talk to somebody about it. And that's
what I love about you. I think you scream in the way that the Bronte sisters would, integrity. And I think that's really important, because we're vulnerable, aren't we, at this time in our life, and we could so easily be taken advantage of. But you know, thank you so much for giving me your time. I would love to do some more of these with you, because I think people will want to know more from you. But for now, thank you so much, Dr. Fiona and Dr. Samantha. Thank you for giving me your time. And people can keep sun safe during the autumn, because that's important and all year round, isn't it?
Yeah, and you can get it on Amazon or get it whatever, even if you have stuff from the kids at home, slap it on.
Lovely, thank you. So I'm going to stop recording now, but thank you for now.